So this is a familiar scene. Talk about foreshadowing. Except this time, the self-quarantine is real. I just came back from the hospital where they tested me for COVID-19. So let's run through the testing process that I went through. First, I called ahead to my local hospital. They directed me to a fever clinic where I was issued a face mask. I then lined up and my details were taken, as well as my temperature and information on any previous known contact with coronavirus cases, and a lengthy wait of about 2 hours to go into a sterilized room, which is sterilized every patient that they see, and be swab tested for COVID-19. The swab test includes a swab about 15 centimeters long, being placed through your mouth and touching your tonsil, and down the back of your nose, and also almost touching your tonsil. It's inserted about 10 centimeters into your nasal cavity, and it's not very pleasant at all. After this, I was issued with a medical certificate for the purposes of my workplace, and I am now in home quarantine for another 7 days, having already had 7 days pass since my contact with known coronavirus cases. So now I will be spending the next 7 days in home isolation because of my contact with them, and I will find out in 72 hours, which is the testing time as of the filming of this video in Australia, whether I have COVID-19. For me personally, COVID-19 probably isn't going to be a problem. However, I'm more worried about passing on the contagion to the susceptible population. Now, I'd like to stress that I haven't tested positive for COVID-19 yet, and the reason they've put me in home isolation is actually because I've had contact with known cases of COVID-19, and the fact that I've shown symptoms of the virus means that they've asked me to undertake home isolation. So along with a medical certificate that was supplied to allow me to take time off work, they gave me a home isolation fact sheet. In this fact sheet, it covers who should be isolated at home, whether you need to wear a mask in your home, the question of other people in your home at the same time, whether carers and household members need to be isolated as well as the person being isolated, how we can help prevent the spread of the coronavirus, going outside, cleaning, keeping up spirits while in home isolation, reducing boredom during home isolation, and where you can get more information. So, in the category of who should be isolated at home are people that are well enough to receive care at home, people who have appropriate caregivers at home, whether the person has a separate bedroom where they can recover without sharing an immediate space with another person, whether the person has food and other necessities at home, whether they have access to the recommended personal protective equipment like masks and gloves, and anyone that does not live with household members who may be at increased risks of complications from novel coronavirus infection. For example, people over the age of 65, young children, pregnant women, and people who are immunocompromised or have chronic heart, lung, or kidney conditions. It also recommends that when traveling to your location of isolation, you use a personal vehicle not public transport. Elderly people and those with compromised immune systems or chronic health conditions should stay away. If you are sharing the home with others, you should stay in a different room from them or be separated as much as possible. You should use a separate bathroom if available. Avoid shared or communal areas and wear a surgical mask when moving through these areas. If you are a confirmed case, the people you live with and other close contacts will need to be isolated at home. They will be contacted by your local public health unit and told how long they need to be isolated. So once I know whether I have the virus, my partner will have to be isolated as well if the test comes back positive. So I'll provide a link in the description to photographs of the discharge advice that I received from the hospital. However, these will be updated regularly as knowledge about the virus progresses, and up-to-date information should always be found on your local government's health website or at the World Health Organization's worldwide.org website. Now, fortunately for me, if I do have the virus, I've only got a very mild form of it, and I'm not worried for my health at all. However, I am worried about passing on the contagion to the population that this virus can adversely affect. So I'll keep you updated on things as they progress here and how home isolation affects my life personally over the next 7 days that I am in home isolation. I hope you enjoyed this episode of Hoochos. It was an unexpected episode, and we'll see how things go. See you next time.